Welcome, everyone. Today's session is about verbal de escalation in EMS, a crucial skill for EMTs and paramedics. We'll explore how effective communication can calm agitated patients and diffuse potentially dangerous situations before they escalate. In emergency medical services, encountering angry, fearful, or combative individuals is common. In fact, surveys show nearly all EMS providers have witnessed violence or threats on the job, and 1 in 5 face verbal abuse almost daily. This presentation will teach you techniques to stay safe and professional when emotions run high. By the end, you should feel more confident handling hostile patients or bystanders with empathy, tact, and control. Let's get started on keeping scenes safer through communication. First, we'll recognize why verbal de escalation is so critical in our field, not only for patient care, but for our own safety. Next, we'll learn key techniques, both what we say, verbal, and how we act, nonverbal cues, that can defuse a tense situation. We'll then apply these strategies to specific scenarios: psychiatric emergencies, dealing with intoxicated patients, and domestic or family incident scenes. Throughout, we will emphasize core principles: staying safe, using effective communication, maintaining proper body language, and controlling the scene. By meeting these objectives, you'll be better prepared to handle real world situations where a patient or bystander is agitated, hostile, or scared, and guide things toward a calmer, safer outcome. In EMS, agitated or hostile behavior is a common challenge. Patients may be in pain, frightened, under the influence, or experiencing a mental crisis, all of which can lead to anger or aggression. Family members or bystanders might also be upset or panicking. This creates real risks. Without de escalation, situations can spiral into violence, causing injury to providers, patients, or bystanders. Our ambulances don't come with security teams. It's often just us on scene initially. That's why our goal is to calm the situation before it turns physical. Verbal de escalation is usually the first and best tool to do that. If we can talk someone down effectively, we improve everyone's safety. Patients who feel heard and respected are more likely to cooperate with treatment instead of fighting or fleeing. Ultimately, mastering de escalation means we can deliver care in a safer environment and possibly avoid using restraints or having to call law enforcement, except when absolutely necessary. It's about keeping things under control with words instead of force. Let's cover some core principles. First, stay calm. As the provider, your demeanor sets the tone. Take a slow breath before engaging. If we appear anxious or aggressive, the patient may mirror that. Instead, project calm confidence. Second, be empathetic. Try to imagine what the patient is feeling: fear, pain, confusion, and acknowledge it. Simple phrases like, "I can see you're frustrated," can validate their feelings. This doesn't mean you agree with any inappropriate behavior. It means you show you care about how they feel. Third, show respect and honesty. Introduce yourself, explain your role, and be truthful in your promises. If you say, "I'm here to help you and I will listen," follow through. Never lie just to calm someone. For example, don't promise, "We won't go to the hospital," if you know they need to. Even a distressed person can sense dishonesty, which destroys trust. Fourth, avoid arguing or getting defensive. You may encounter insults or curses directed at you. Do not respond in kind. Remember, they're not upset at you personally, they're venting pain or fear. If you argue back or show anger, you'll only escalate the confrontation. Instead, let negative remarks slide off without ego. Finally, keep it patient centered. Focus on what the person needs: medical help, reassurance, and their safety. Gently guide the conversation toward how you can assist them. By following these principles: calmness, empathy, respect, non defensiveness, and patient focus, you lay the groundwork for successful de escalation. While de escalation is about communication, scene safety is always the top priority. Assess for threats as you arrive. Are there weapons visible or objects that could be used as weapons? Is the environment risky? Poor lighting, tight space, angry crowd? If you sense danger, do not rush in blindly. Next, maintain a safe distance and identify exits. A good rule is to stay at least 2 arms lengths away from an agitated person. This gives them personal space and gives you reaction time. If you're indoors, position yourself closer to the exit than the patient is. That way you can leave quickly if needed, and importantly, never let the patient block your escape route. For instance, in a small room, stand between the patient and the door. Don't get cornered. Also, never engage a hostile patient alone. If you're an EMT with a partner, coordinate so one is ready to call for help. If violence is possible, having law enforcement on standby is wise. Don't hesitate to request police assistance early. Many protocols suggest staging until police secure the scene for known violent situations. Remember, your personal safety is the priority. It's not patient abandonment to leave a scene that's unsafe. If a scene becomes too dangerous, you have the right to back out until it's safe. You can't provide care if you're injured. So, set yourself up for success. Maintain space, have an escape plan, and ensure backup is available. Safety first, always. How you initially approach an agitated person can make all the difference. Approach slowly and from the front, never from behind. A sudden appearance from someone's blind spot can startle them. Make eye contact if they allow it, but keep your expression relaxed and concerned, not stern. Crucially, keep your hands visible and palms open as you come forward. An open palmed, relaxed posture is a universal sign that you mean no harm. If you're carrying equipment, try not to fidget with it in a way that could be perceived as reaching for a weapon. Showing empty hands, with palms up, signals, I don't want to fight. Avoid clenching your fists, pointing, or crossing your arms. Once you're at a reasonable speaking distance, introduce yourself in a calm, friendly tone. For example, hi, my name is Megan. I'm a paramedic. I'm here to help you. This introduction establishes you as a caregiver, not a threat. It can also slow down the encounter. The patient hears a calm voice and simple introduction, which can slightly shift the mood. Then ask for the person's name and use it during conversation. What's your name, sir? And then, okay, John, can you tell me what's going on today? Using their name helps personalize the interaction and build rapport. It shows respect. Throughout, speak slowly and softly. Not so soft that they can't hear, but gentle enough to be soothing. The initial approach is about not appearing aggressive, establishing a human connection, and beginning to earn trust. Now let's talk about specific communication techniques to de-escalate verbally. The first and most important is active listening. Often, angry or scared people simply need to be heard. Allow the person to talk and vent without jumping in immediately. Nod to show you're listening. Maintain an attentive expression. Don't interrupt their rant with corrections or arguments. Let them get it out. If they shout or swear, you can take it, as long as it's just words. Once they pause, you can respond. Validate their feelings before anything else. This can be as simple as saying, I can see why you're angry, or I hear that you're frustrated about what happened. This acknowledges their emotion without necessarily agreeing with any incorrect facts. It shows empathy. A very useful phrase here, a kind of magic de-escalation phrase, is, let me see if I understand you correctly. One EMS veteran swears by this line. By saying, let me make sure I understand you, and then calmly paraphrasing their main concerns, you achieve a few things. You demonstrate that you care enough to listen, you ensure you're hearing them right, and you give them a chance to clarify. Often, this simple act of listening and reflecting back can significantly diffuse anger. It's like holding up a mirror. So, you're upset because you've been waiting and you're in pain? Is that right? When they hear you sum it up, they often feel a bit of validation and may correct or add details in a calmer way. Active listening can truly disarm anger, fear, and confusion. After listening, offer help or options to address their needs. Ask something like, what is it that you want to have happen now? If it's realistic, like, I want to sit up or I don't want to go to hospital X, see if you can accommodate or compromise. Giving a small measure of control helps. Would you like a drink of water or to call your family? We can do that. Or we need to get you to the hospital. We can take you to the closest one or another of your choice if feasible. Let's talk about that. By involving them in decisions when possible, you reduce the feeling of powerlessness that often fuels aggression. Throughout all this, keep your voice calm and don't rush. Silence can be okay. It gives them time to process. The key techniques: listen more than you talk, show you understand their perspective, and gently guide the conversation toward solutions. Remember that 93% of communication is nonverbal, tone, and body language. In de-escalation, how you say things is often more important than what you say. First, check your posture. Keep a non-threatening stance. Stand at a slight angle to the person rather than square on chest to chest, which can feel confrontational. Keep your hands relaxed and visible, as mentioned, open palms. Avoid putting your hands on your hips, which can be seen as authoritative, or making sudden movements. Don't loom over a seated patient. If it's safe, you might crouch or sit to be at eye level. This shows you're not trying to overpower them. However, don't get so close that you violate personal space. Keep a comfortable distance so they don't feel trapped. Next, be mindful of your facial expression. It should be neutral to sympathetic. A look of genuine concern or empathy helps. Don't glare, scowl, or smile inappropriately. If someone is very angry, a smile can be misinterpreted as mocking. Just stay relaxed and attentive. Eye contact is tricky. You want to look at them enough to show attentiveness, but don't engage in a hard stare. Staring can be perceived as a challenge. Instead, periodically make eye contact and break away naturally. You might nod while listening, which naturally breaks eye contact now and then. Your tone of voice should be calm, low, and reassuring. Speak softly but clearly. A lower tone, not to be confused with a mumble, can have a calming effect. Avoid any hint of sarcasm or impatience. Even if a patient is yelling, you maintain a controlled voice. This can influence them to match your calmer volume over time. It's almost like you're the thermostat, setting the temperature of the interaction. Also, use a respectful, polite choice of words, sir, ma'am, if appropriate, or their name. Phrases like, I want to help you, let's work together on this, spoken gently, reinforce a cooperative atmosphere. On the flip side, avoid sharp or commanding tones unless absolutely necessary for safety. Barking orders, sit down now, can escalate tension unless the person is in immediate danger. As a general rule, your body language and tone should consistently convey, I am not a threat. I care about your well being, and I have patience. This nonverbal messaging builds trust subconsciously, complementing your verbal techniques.